Let's talk about some of the urban legends and myths about methadone. Methadone, more than any other medication that we use, carries so many myths and urban legends about it. The most famous ones are that it rots your teeth, that it gets into your bones, and that it's the hardest detox of all opiates. Let's talk first about what's true. What's true is that if you're on methadone for a long time and at a high dose, it is a harder detox than a conventional opiate. That much is true. Methadone detox is possible, though. It may require additional skill and special treatment, but it is possible. Typically, a person is either weaned slowly over the course of 4 to 6 months, or maybe longer, or they are converted to another medication and later subjected to a more standard subutex or suboxone detox. But coming off of methadone is possible, and it's possible to do so safely. However, coming off of methadone is more difficult. That much is true. It's also higher risk for having post-acute withdrawal symptoms, which is a lower grade state of withdrawal that drags for weeks to months. But again, if that happens, there are also things that can be done to resolve that. Now let's talk about some of the urban legends that are not true. Methadone rots your teeth. This is one of the more famous legends that is really not true. It really does not rot your teeth. Now, how methadone is taken in a methadone clinic can affect your dental care, though, and your dental hygiene. Now, a lot of this first off has to do with the clients of a methadone clinic. The tendency among that population is to have deficient dental hygiene. They tend to just not take care of their teeth as well as they could or they should. For anybody, if they do not take care of their teeth will have problems, and will have problems rather quickly. Now also, if you have a condition like opiate dependence, which if active it leads to a lot of vomiting, that also wreaks havoc on somebody's teeth. Aside from that, the fact that methadone in a methadone clinic is usually given as a liquid that is swallowed, that does affect the teeth in terms of any medication that is taken orally as a liquid will affect a person's enamel, as far as the medication can actually erode their enamel. So really anybody taking any oral medication that is a liquid must always follow that by brushing your teeth immediately after. But again, that applies to anybody and everybody who takes an oral liquid medication. Methadone is not particularly special in that regard. The other legend is methadone gets in your bones. This is really not true, but it appears as if it's true due to the nature of opiate withdrawal when it comes from methadone use. Now, when somebody is withdrawing from methadone, there's a tendency to experience bone and pain as one of the symptoms of methadone withdrawal. That is a heightened state of pain that a person would have normally in withdrawal, only more specifically for methadone, they feel the pain in their actual bones, giving the illusion that methadone has impregnated their bones. And really, it does not do any impregnation of the bones that is meaningful to any degree, but coming off of methadone, there is the known symptom of bone pain, and that is what many have misinterpreted as methadone getting into their bones.